think I'm fine. We can start the video. Hi everyone, welcome to Blackbird Pharmacology. Today we're going to talk about antihypertensive. This is the first video in the series of 3 videos. Right, let's get started. Now first I have a question for you that I'm going to answer to you at the end of this video, and I want you to think about it while we discuss the first part of this section of antihypertensive treatment. The question is, what are the effects of NSAIDs on blood pressure? There you go. Think about that one. Okay, so we are going to look at antihypertensive therapy. Okay? So in this first video, we will only be discussing the importance of antihypertensive, the classification of blood pressure, some tips when taking blood pressure that you maybe forgot and that you need to remember that are quite important. According to the GPP, which is the Good Pharmacy Practice, it's a document we use in South Africa and that our pharmacies are using as a guideline on how to be set up properly, and also when the Pharmacy Council come and inspect your pharmacy, it's done accordingly to the GPP. Right, so why is this topic important, guys? It's because there are a lot of people that are hypertensive and there are a lot of antihypertensive drugs out there. So if you can know the interactions and the side effects of these drugs, you are going to ensure that your patient gets the best therapy. Alright, now let's look at the classification of blood pressure. Now the classification is according to the measurements that you will be taking with your blood pressure monitor. Now there are different types of blood pressure monitors. We're not going to discuss that in this lecture. We're just going to talk about when is it very important to refer a patient and when is it okay and you can still maybe recommend some lifestyle changes and so forth. Now if in South Africa we meet it over millimeter mercury, so if it's less than 120/80, your patient is perfectly normal, nothing to stress about. If it's a bit higher than that, you can maybe talk to them about some lifestyle adjustments that they can make to lower their salt intake and so on. And then if we get here into the 150/99 range and the 160/100, this is the place where I will definitely recommend my patient to see a doctor as soon as possible. I would highly recommend you to print out a similar table like this, keep it up on the pharmacy wall, and when you're taking blood pressure, you can always refer back to it, show your patients the different stages of hypertension that they can be in, and it's just a nice and handy guide to have. Alright, let's look on to some 10 important tips that you need to remember when taking blood pressure. Now this is not an SOP on how to take blood pressure. You will find that in your pharmacy and it will be according to the blood pressure monitor that you are using in your pharmacy. This is just some additional tips that I got for you in the GPP. And this includes explain to your patient what you're going to do, why you're doing it, and just some introduction to the procedure you're doing. Because when you get a patient into the consultation room, it's advisable for the patient to sit down and relax for at least 3 minutes. So use this explanation time to get to that 3 minutes where your patient can just chill and just be comfortable where they are. Alright, then training. You need to have adequate training. Take a coworker, practice on them, watch some YouTube videos. Just train yourself, equip yourself, ask your pharmacy to send you to a course on how to take blood pressure if it wasn't included in your varsity of university course. But before you take in that first patient, make sure you have adequate training. It will give you confidence and it will also make your patients trust you to prevent any uncomfortable situations and just to give yourself that boost of confidence. Okay, then same healthcare worker with the same apparatus. That's important. If a patient is coming for consecutive blood pressure takings, make sure it's the same person with the same blood pressure monitor. Then a patient should not smoke, exercise, or drink coffee or tea 30 minutes before you take their blood pressure. This can influence the value that you get, as well as you must always take into account the age of the patient and if they are taking any medication. Alright, then the arm must always be rest on the same level as the heart. Use the same arm every time, and you can only make a diagnosis, or in this case we're not going to diagnose, we're going to refer our patients if you have 3 different scenarios where the patient's blood pressure was high on 3 different days. Okay, Then the last thing I want to mention to you is when you write down the blood pressure reading for that specific occasion, note down which arm was used and if the patient was in a sitting or a standing position. This will only help the other healthcare workers who's going to take care of this patient further to make the correct diagnosis and just make their job easier. And lastly, let's discuss some of the causes of high blood pressure. A question you'll get often asked in the pharmacy: why do I have blood pressure? I'm not an inactive person. I don't eat unhealthy. Here's some of the answers that you can give them. Stress is the number one factor for high blood pressure. Stress is a very big contributor. Okay, then also smoking, dyslipidemia, obesity, diabetes, an increased salt intake, and unfortunately it is also heritable. So you can get it from your parents or someone. If you have a family history of hypertension, that might be the reason that you have it as well. Alright guys, that's our first video. Now, do you have the answer to that question yet? If not, let me tell you. NSAIDs are inhibiting both enzymes COX-1 and COX-2. Now COX-2, if it's inhibited, it causes sodium retention by the body, and this can increase the blood pressure. The second thing NSAIDs does is they cause an inhibition of prostaglandins, and prostaglandins, when they're inhibited, they cannot cause vasodilatation, so we're going to get vasoconstriction instead, and that will also lead to high blood pressure. There's two mechanisms for you on how NSAIDs are contraindicated in hypertensive patients. Okay, thank you guys so much for watching, and so I'll discuss the rest of the antihypertensive treatment information in the next video.